So the current standard therapy for newly diagnosed multiple myeloma is using a combination of a proteasome inhibitor and an immunomodulatory drug. So there was a recent phase 3 trial demonstrating that a combination of bortezomib, lenalidomide, dexamethasone significantly improved overall survival compared to just lenalidomide and dexamethasone. Now the question is, where do we go from there? How do we actually improve upon that combination of bortezomib and lenalidomide and dexamethasone? So there are several different avenues. One of them is to see, can we actually get more potent drugs within each of those classes of drugs, or more convenient drugs within the same class of drugs. So there's the carfilzomib, lenalidomide, dexamethasone combination that have shown very interesting results in the phase 2 studies, and there's a phase 3 trial called Endurance trial, which is run by the Eastern Cooperative Oncology Group, that is comparing the bortezomib, lenalidomide, dexamethasone combination against carfilzomib, lenalidomide, dexamethasone combination. So clearly that is a trial that will tell us, have we improved the outcomes by changing the type of proteasome inhibitor. The second approach is to see, can we use something that is more convenient and something with less side effects that people can stay on for longer periods of time and still get good benefit. So there's a trial of ixazomib, lenalidomide, dexamethasone, which is the oral proteasome inhibitor that is currently ongoing. That's again a phase 3 trial. Now the third question is, can we actually add something else that is of a totally different class of drugs to that triplet combination? And one of them obviously is the monoclonal antibodies. So there are clinical trials looking at adding both daratumumab as well as elotuzumab to these triplet combinations to see if we can make it even better. Now there are other classes of drugs being examined as well. For example, penobinostat is a drug that was recently approved for use in myeloma, and there are smaller trials ongoing that are looking at combining the penobinostat to a combination of a proteasome inhibitor and an immunomodulatory drug. So there are exciting classes of drugs, especially the monoclonal antibodies. That is something we would all be looking forward to.